Ladies and gentlemen, good morning. Now, I usually start our webinars with a hello, but today I am going to start with a thank you. I want to thank all our participants for participating in our post-COVID COVID Beat webinars. Now, when we were reviewing this information the other day, we discovered that on occasion we've had more than 100 participants, but the average is about 70 participants, and delightfully from several countries. We have participants from more than 17 countries who listen in to our webinars, and the range is across the Middle East. That would include Saudi Arabia, Qatar, the UAE, and every other Middle East country, India, Pakistan, the Philippines, Afghanistan, several countries in Europe, even listeners from the United States, Canada, Australia, and New Zealand. So I would like to thank our participants very much for tuning in to our webinars. Now, today we have a special treat for you. More than 60% of the world's population is overweight. Now, we know over the years that obesity is related to diabetes, cardiac ailments, and even some cancers. But what I learned in my reading yesterday, when I was reviewing our topic in relation to COVID, was that people with COVID who were obese had a 60% probability, higher probability of being hospitalized. And 74% of obese individuals who are hospitalized invariably require ICU treatment. That's one side of the story. The other interesting anecdote is that obese individuals who are vaccinated have a 50% higher probability of catching the virus once more. So obesity has spread its tentacles even into COVID. And now, friends, in order to manage this exciting topic, we have our senior-most physician, Dr. El-Hadi Abbas. Now, Dr. El-Hadi has the longest tenure of any physician in RAC hospitals. He is the senior-most member of our medical fraternity. Dr. El-Hadi has more than 32 years of experience. He has worked across the Kingdom of Saudi Arabia, Sudan, the UK, and we in the UAE are grateful for his presence. He's an active contributor to several seminars, many medical conferences, and he is frequently heard on radio and television. For his great accomplishments, he was appointed the ambassador in Tennessee, the Tennessee Ambassador of Goodwill by the governor of Tennessee, and he is an honorary citizen of Johnson City, Tennessee, USA. Ladies and gentlemen, RAC Hospitals is proud to present our senior-most physician, Dr. El-Hadi Abbas.
Well, let me start by saying hello. And again, thank you all for coming. Thanking Professor Kennedy, our chairperson, for this nice introduction. And thank our participants for honor the village. Okay. And I'm really honored, okay, and thrilled to be part of this webinar. Well, Professor Kennedy had made it much easier for me to speak about obesity because he said, well, he maybe, okay, got it to the point, all of it, okay? My topic today is obesity and COVID in a short time. Those are my disclosure. I have no conflict of interest in this talk. And then, well, let us start by saying, okay, or repeating what Professor Kennedy said, okay? Obesity is a pandemic worldwide nowadays, okay? About in 2015, the number of obese people worldwide was around 640 million people. That has doubled since the year 1980, and it's all over the world. We're not different in the UAE. Maybe in the UAE, about 40% of the male population are obese, 38% of the female population are obese as well. Obesity has been, considered a long time before, not a disease, okay? We have known, the complication of obesity, okay, its contribution to certain diseases, maybe for more than 2,000 years. However, it was not considered a disease. It was, maybe a cosmetic problem, maybe a social problem. And then most of the world organization, okay, important words came with a definition of obesity, saying that obesity is a complex, a obesity-based chronic disease where management targets both weight-related complication and its ability to improve overall health and quality of life. Because if we define obesity as, simply we will say, well, a BMI above 30. Again, that, has to be different in different ethnic groups. Well, maybe in Southeast Asia, can you hear me, by the way? Hello?
Yes, sir. Yes, sir.
Yeah,
absolutely.
Yes, all right. Yeah. So maybe in Southeast Asia, okay, the BMI of less than 30 should be considered obese. Okay. And apart from, the BMI, there is another part of obesity, which, a disposity or distribution of fat. And the worst part of fat distribution is around the tummy. You can see from here, the American Association of Clinical Endocrinologists, American Medical Association, the World Obesity and Endocrine, all of those sites has considered obesity now a disease. And when we come to say what causes obesity,
Dr. Ilhadi,
yes, yes.
Just a small interruption. We are not able to see your slides.
How come? Yes, hold on. I think I shared them. Let's share the screen again. Can you see them now?
Yes, sir. Perfect.
Yeah, I'll just go one slide back, okay?
No problem.
Yeah. Yeah, this is a definition of obesity which I spoke about. Okay, and I said most of the world organizations have considered obesity as a disease. Before we used to say, well, it is a cosmetic problem, maybe a social problem. And now coming to the causes of obesity. If you make it simple, you say, well, you eat more, you exercise less, or you do less, okay, or you walk less, okay, you get obese. That's the simplest way, because as we say, obesity is a balance between input, okay, and output. Input is what you eat, and output is the energy you expend. If you don't spend a lot of energy, okay, that excess food, okay, excess calories, okay, turns into fat. Apart from that, there is a biological, problem, okay, which is improper regulation of adiponectin secretion, which increases appetite, okay, and reduce the energy metabolism. And this maybe have some effect in some patients where you tell them, well, exercise, and they tell you, well, we have been doing this a long time before we exercise daily, we eat less, we eat healthy, still we don't lose weight. Well, you can't blame them because there is part of that which is biological and they cannot, take care of it. The other factor, which is genetic, there are certain genetic diseases, okay, inherited diseases which can cause obesity. And generally there are certain genes, okay, which can cause obesity as well. And we know that obesity again runs in the family. You can see families, okay, of obese people around. Another one is environment. And you can say that, well, if you say it runs in families, okay, the families eat, well, they have used to eat more, okay, so children follow their parents, which eat more, okay, spend less time in exercising, then they do the same habit and they go into obesity. Well, again, that's a very important thing because always in society you had, a weight pass. we have negative attitude towards those people with obesity. And that can take the form of verbal, relational, cyber, physical, and bullying. Okay, we know that, okay, children who are obese are usually bullied in school, okay? They hear, physical abuses, okay? And that abuses can be, overt. They tell you in your face like that, well, go that you obese person or something like that, or it could be subtle, okay, given into, sorry, it could be subtle, very clear, or overt in a way where it hurts people. And we should be saying to those people, usually, it's not your character, it is your chemistry, because it's something to do with your chemistry which make you obese. So you shouldn't blame yourself for it, okay? But you try to amend it. Well, and why do we say, well, obesity is a chronic disease? Because as Professor Kennedy was saying, it affects almost every organ in our body. And I'm just going to go through quickly over different organs in the body. Well, it affects the brain, causing more of patients with migraine. It causes depression, sodium tumor cerebri, or increase the cranial pressure, where you get, the pressure inside the brain increases and people get headaches, okay, blurring of vision, visual disturbances. It causes obstructive sleep apnea. In the lungs, okay, those people have got more chronic obstructive lung disease, they've got more asthma. In the liver, they get what we call non-alcoholic fatty liver, okay? This can occur in lean people, but it's much more common in obese people. Type 2 diabetes is much more common in obese patients. Okay, polycystic ovary syndrome is usually associated with obesity in young girls, and it's a cause of infertility and needs treatment. Those people are more prone to thromboembolic disease, where they get thromboid in their vessels, okay, which can go to the lungs, okay, because they have what we call venous state. The blood does not, circulate rapidly into their circulation. In the heart, okay, we get cardiovascular disease and we get hypertension. They are more prone to dyslipidemia. In the stomach, okay, they get what we call reflux disease, which is acidity. Cancer was being told by Professor Kennedy. The common cancer which occur with obese people more than lean people is in the female, okay, uterine, cervical, endometrial cancer, ovarian cancers, breast cancers, okay, and in male than female, okay, rectal, colon cancer, okay, kidney cancers are more common in obese patients. Obese patients have got, that problem, disabling problem of stress incontinence, where, they just, pass urine, without controlling it, okay, especially in certain conditions when they cough or when they do physical exercise. A lot of musculoskeletal problems, come with obesity, like, osteoarthritis in knees and hips because of the heavy weight on those knees, leading to osteoarthritis, which sometimes is very painful, sometimes even disabling, sometimes needing surgery and change of joints. Gout is common in diabetics. Well, what about COVID? Okay, we know patients start having minor symptoms of COVID. Okay, and those obese people, well, maybe because of the stigma of being obese, they don't go to hospital. They symptom worsens, okay, and then they get delayed care, and that delayed care results in worse outcomes. And as Professor Kennedy said, having obesity increases the risk of severe illness from COVID. And I'm going to go into some more detail later on this. Having obesity might triple the risk of hospitalization due to COVID. If you are obese compared to a lean person who had COVID, okay, the obese person has got 3 times more possibility of going into hospital. And the BMI increases the risk of death from COVID much more than lean people. This from the study by the CDC in the US, they showed that hypertension was the leading comorbidity for hospitalization and severe COVID, followed by obesity more than diabetes and cardiovascular disease. Okay, so if your BMI is above 40, okay, it is the strongest association with critical illness. We know that age and obesity are the strongest association of death and severe critical illness in COVID. However, if you are above the age of BMI of 40, which is morbid obesity, okay, you are more prone to have more critical illness more than an elderly patient. And patients with BMI between 30 and 34 are 1.8 times likely to have critical illness, and patients with BMI above 35, which is again morbid obesity, has got almost 4 times likely to be admitted to critical care with severe illness. Well, again, obesity goes into certain ethnic groups. This is from the States, where they have seen that Black Americans are 1.3 times more likely to be obese compared to Caucasian or white people. Hispanics are 1.2 more times to have, obesity. And in Black and Hispanic, 4 out of 5 females are obese or overweight. And this has been shown when they have looked into their COVID admissions. Okay, those minorities, okay, constitute about 40% of the total US population. However, 60% of the COVID cases were from this minority. Obesity could be a cause, but there are other causes we can't speak about today. Blacks constitute about 13% of the US population. However, from those hospitalized patients with COVID, 33%, okay, were from the Black community. Well, we know that, COVID started in Wuhan in China in December 2019, is what, declared a pandemic by the World Health Organization in March 2020. Has caused, massive health problems and economic suffering around the world. And emerging data suggests that obesity represents a risk factor for more serious and complicated course of COVID in adults. And then we have seen this even in our hospital, okay? All over the world, the health emergency caused by the outbreak diverse attention from prevention and care of non-communicable chronic diseases. Obesity is part of them, to communicable diseases in this particular COVID, okay? Most of the health workers are diverted to care for that pandemic. Well, this again to show you some data about overweight and obesity in Europe, okay? If you see the UK, about 30% of their children and adolescents are obese or overweight. In the adults, that goes about 60, the same thing in Europe. Well, I said to myself, let me take the opportunity to speak to you about, something that maybe not 100% related, but again, it's a nutrition inequity over the world, okay? We have malnutrition in the world as well, okay? 1 in 9 people in the world are hungry, where 1 in 3 are obese. So there is maldistribution or inequity in nutrition over the world, and we should be doing something about that, okay? And that may be the job mainly of politicians, okay, and societies, okay, and health workers has something to do with it as well. Well, why does COVID cause severe disease or more disease in obese patients? Well, it has been a long time shown that adipose tissues, okay, constitute receptors of the angiotensin converting enzyme 2, which is the port of entry of SARS-CoV, and that leads to increased pro-inflammatory cytokines, low-grade inflammation. Your immune status decreases, the pathogen defense decreases, then you get what we know in that obese patient, I have said this before, okay, you are more prone to thrombosis, so the pro-thrombotic factor are increased. Fibrinolysis, which is, a guard against, thrombosis is reduced, okay? You get impaired ventilation in your lungs because of the obesity, okay? And that leads to more infection, more affection of your lungs, and those patients are more liable to get, metabolic complication. Long time before, in H1N1, we have seen that, the viral load in obese patient is more, the shedding time of the virus in those people is more, immunity for infection is less, the vaccine efficacy, and I think Professor Kennedy has alluded to that, the vaccine efficacy is much less, and the chronic progression of the disease is much more in obese patients. From COVID, okay, we have seen that, the risk of acute respiratory distress syndrome is more, hospitalization is more, ICU admission is more, critical care needs are more, and mortality is more. So obese patients are a special group of patients, okay, and we should give them, priority for admission to hospital, because usually there's a bias towards that, even in our hospitals. Well, what about care for non-communicable disease and obesity in particular? This is from the US. In the US, okay, 61% of the staff were diverted from, routine care of obesity to infectious disease, especially COVID, okay? And face-to-face outpatient visits for those patients were blocked almost in 100% of those patients. Outpatient services were transferred to virtual or telemedicine alternative apart from, face-to-face in those patients in about 90% of the patient. Bariatric surgery, which is a good way of treating, obesity, has been, almost stopped or abandoned in 96% of the medical institutions. So what we should be doing? We should be early detecting and testing for COVID in people with obesity. We should promptly treat them, okay, for any COVID or any viral disease, okay, and due to the prolonged viral shedding of them, we should be isolated, okay. They should adopt, more social distancing, and this, can impact, okay, the social and economic requirements. So we should be planning for this, okay, and make cater for those, minimizing the economic hardship and food insecurity in them. And we should encourage them always to vaccinate, although we said vaccination is less effective in them, but still, okay, it can protect them and protect the society. And we should support for them and promote access to healthy food and dietary patterns. Because if you eat, and this was shown in mice, if you eat, fatty fish, okay, and you converting enzyme is expressed more, okay, and this induced by high fat, and this can, lead to easier, introduction of the virus. We should encourage them to have, mild to moderate physical activity through COVID-related strategies, intervention, including tailored modification for those with barriers and physical limitations. And we know that physical exercise has anti-inflammatory effect. It improves immunity and improves morale. We should, have some attention, okay, to addressing the social determinants of health associated with obesity, such as poverty, low level of education, the physical environment, okay, overcrowded neighborhood where poor diet, sedentary behavior, and obesity often coexist. And we should lessen market of non-nutritious edible products, and access to COVID information should be given to them and to health services for vulnerable communities. To develop awareness and consideration of how weight bias and obesity stigma may impact COVID testing, treatment, and care, and health outcome for people with obesity. Well, we should try still to maintain some care for chronic illnesses, including obesity, because we know that our attention has been diverted, okay, from those diseases towards, the communicable disease, especially COVID nowadays. And we should assure safe pathways for those patients with obesity. We should provide them with suitable, okay, size, because that may be a problem as well. Will they be getting, suitable size personal protective equipment for them and for the staff? And we should encourage, facilitate the complementary use of virtual contacts and telemedicine like what we are doing today in obesity care, and prepare for future situations where maybe even seeing patients in clinic should be very difficult. Well, again, coming back to nutrition inequity, okay, and this, we should be addressing it, okay, in food system, and make healthy, sustainable food the most accessible and affordable choice for all people over the population. And we should be integrating nutrition in health systems and make nutrition care, prevention, and curative universal available. And we should seeing that, this sort of service available to all people. And I'm going to come to that because that is very deficient nowadays. What challenges do we have in the health systems? Okay, I'm going to just mention them here quickly. Leadership and governments, health workforce, health system financing, access to essential medicines, health service delivery, and health information system. Here, we need a strong government coordination on nutrition, which is lacking, and we need to do that, and we should encourage, organization, okay, authorities to have some more impact and some more care about this problem of obesity. Okay, we should increase the healthcare workforce, which cares for nutrition and obesity in general. Okay, medical professionals, nutritionists, okay, dietitians, doctors, endocrinologists, all those things. Okay, we should finance this part of healthcare system, okay, of nutrition and obesity. And again, I can tell you, okay, most of the insurance companies, okay, they don't cover, treatment for obesity. So the access to essential medicine for obesity is lacking because of lack of insurance coverage. And as I said before, insurance, okay, health service delivery or nutrition service are limited and lacking, and we should be focusing on increasing this part of our services. And we should be giving information to all patients. This slide will be your last slide. Is just speaks about, approved obesity medications. Okay, and there are so many medications which are being approved for obesity. Nowadays, the commonest ones are what we call the GLP-1 GLP-1 receptor agonists, which are mainly injectable, okay, and some of them can lead to reduction in weight up to 20%. The optimal reduction in weight, which can lead to better outcome in obesity generally, is 5 to 10%. So if you achieve at least 5% of your weight reduction, you're achieving something good. Less than 5% is not good. The more is better for sure. Okay, those drugs can give you up to 20%. And I think because of the time, I'll have to stop there. And thank you very much for listening. Thank you very much.
And thank you very much, Dr. El-Hadi. Thank you so much. That was enlightening. There are 3 points that I've picked up from Dr. El-Hadi's very, very wise utilization and explanation on obesity. 1, obesity is the strongest chronic condition relevant to COVID severity, which would mean then that obese individuals have a higher propensity to hospitalization than non-obese individuals. That's 1. The second point that I picked up from Dr. El-Hadi's presentation was that while obesity was widely known to be relevant to non-communicable diseases like diabetes, hypertension, cardiac ailments, etc., it has now moved across even to infectious diseases. COVID is a prime example of the relationship between obesity and an infectious disease. That is a very relevant point. And the third, and perhaps the most important in my own estimation, is Dr. El-Hadi's suggestion that obesity should be covered or should be considered by insurance. Now, if 60% of our population, or 40 to 60% of our population in the UAE is overweight and obese, it makes good sense to cover this by insurance. And that is a brilliant suggestion made by Dr. El-Hadi. As always, sir, thank you for your great wisdom.
Thank you.
We now have our second speaker today. And Ruba has been kind enough to make a presentation earlier also, I remember. And today, Ruba will be talking specifically about managing obesity. Now, Ruba, besides being a dietitian and who manages therapeutic nutrition, which would mean dietary advice related to individuals who have various chronic ailments and therefore working out of a hospital, Ruba is also a professional health coach. The majority of individuals who are overweight are not hospitalized. They live in the community, and therefore this great knowledge that Ruba has as a health coach will be vitally relevant in weight management in our community, even while, of course, Ruba will continue, I'm sure, to associate individually with individuals who have chronic diseases in relation to obesity. Let me remind you, friends, that the advice given to us by Ruba comes from an extremely good source. She is a member of several professional associations: the American Academy of Nutrition and Dietetics, the Arab Nutrition Association, the UAE Nutrition Association, and also the Emirates Medical Association. Ladies and gentlemen, the major problem that we face today is obesity, and giving us advice on how to manage this is our own Chief and Head of Department of Nutrition, Ruba.
Hello, good afternoon. Thank you, everyone. And thank you, Dr. Alot, for this lovely introduction. As indeed you said, obesity is a major concern nowadays, not only for facing the pandemic, it's also connecting and affecting other health outcomes. So I'll be sharing my presentation so we can go over. So I'll be discussing the outcome more of like continuation of what Dr. El-Hadi was focusing on, and how to manage the obesity in this pandemic and post-COVID. And it's very important also to know the behind and the source of outcomes on the body, to be able to manage that and prevent it from progressing. And we know that obesity, it's considered a chronic disease, and it's currently the major strategy. There is a major strategy to take action regarding the management of these obese patients. Definition of obesity, mainly a person, or particularly patients, unhealthy patients with body mass index that reaching beyond 40. And there is a plan for long-term programs to help these patients. Various evidence exists for the benefits of providing multidisciplinary supportive programs that will include not only dietary, also a psychological outcome, a motor or functional, physical, and all of that coming together to help these patients to outgrow the effects of being obese. And we need to know that obesity has a main effect on becoming or worsening the outcome of COVID. As patients, if they do actually were persisting with obesity or higher body mass index, it is later on affecting the outcome and the progression, and maybe later on for long-term effects on the lungs, on the body, and so on. And indeed, this pandemic has resulted in a lot of changes on daily life and many health-related behaviors, starting from the lockdown and not being able to, or not having access to daily routines that includes maybe more on physical activity. It put on the more stress on these people to have or alter their behaviors. And actually, one of the major factors that affected or worsened the complications during the pandemic was obesity. And even it, in some cases, it led to death. Several recent studies have been published, and it's impacted and it reported on the impact of the COVID on the body and on adults who were overweight or even obese. The majority of these publications, they highlighted on the importance of both combination of mental health and then dietary health, dietary approaches, and physical activity. So it's very important to do some kind of psychological treatments and support to these patients during the effect or during the illness and afterwards, and following up with these people, because for the longer run, the effect will may worsen their health, and they may need actually better control. The association on obesity was due to stress, maybe anxiety and mental illness, and actually it worsened, as I said, during the pandemic, during the changes, the restrictions that were put actually on the severe restrictions that were put on the people. And significantly, obesity, it increased the risk for severe illness, Some patients will require hospitalization, and it also in some cases led to mortality and death. It has increased, COVID increased the urgency to reduce obesity and related comorbidities. As we know, it actually, it's an infection, and it worsens the inflammation in the body, and it leads to putting the pressure on the health of the body in many different kinds of the body. Now, if we can go back to the study that I was mentioning, the relation between anxiety and depression, if we can see in a majority of the people, like around 70%, they reported that their outcomes worsened because of they were more of like stressed. And it may lead to some of the cases above 80% depression, and those were difficult to achieve any outcome later on. They reported to reach out between 60 and 70%. Indeed, obesity is a disease, and it needs to be monitored closely with a big team of physicians, includes physicians, different specialties, and they should be aware of and they should put a plan ahead of time what would be the effect and the outcome during the illness and after that. It should be implemented across the life course, from preconception through childhood and into older age, even if there is unhealthy or healthy adults. Surely, a worsening of the clinical functional complaints and nutritional metabolic status was observed in these patients due to the changes in their lifestyle habits, and many become stressed, depressed as a result. The exposure to the news, as I mentioned before, the social isolation, which led to an increased incidence of the eating disorders. That's something that we did not highlight on before, but we have seen and encountered in so many hospitalized patients. And after they are discharged, they either go in binge eating, so they tend to eat more and more and more until they burst and start vomiting, or they just completely avoid the food itself, whether they were with a normal BMI or abnormal BMI. But majority of cases, they reported to increase their weight due to this pandemic. So it is very important to innovate some strategies to avoid non-social communication and then the virus, to also do some more of the follow-ups. Now, how to manage the weight, and what are the things that we can help these patients during or before, like there sometimes if we put some kind of precautions and we can just encourage them to get healthy in general. So for at least if they get the infection, they know how to handle their bodies during, and they will be expecting what can their body leads to afterwards. It will include a combination between behavioral changes. We need to give them some kind of individual or group meetings, or like any kind of gatherings that can either it is like we can do it even online on their free time. We can just give them some kind of tips, ongoing tips, reminding them of the effect of the obesity on their bodies in general, and how to deal with if they are get infected. If there is any kind of supplementary treatments that can boost their immunity beside the good diet, like for example any kind of extra vitamins, or for those, for example, who are excluding some kind of food, maybe vegetarians or non-vegetarians or pescatarians, avoiding like other peoples that are with different intolerances and allergies. They will be avoiding certain kind of foods that is lacking certain kind of supplements. So we try to compensate with the diet, plus we try to give them as much as possible to reach out the recommended daily intake. We'll keep reminding them about the importance of being normal body weight and the effect of losing up extra body fat and being healthy, eating healthy, having a good dietary sufficient in nutrients and in calories on a daily basis. And then also we try to encourage them to do some kind of physical activity that is not done less than 130 minutes in a week. During the illness, we don't actually focus on being active as much as being healthy, and trying to do the daily core just to compensate and recover faster. Maybe we can do like some kind of walking or basic exercises, but we focus more on post exercises or post focus on post delivery, post the infection, maybe some kind of exercises that focuses on the core strength and on breathing. This is very important. Supported by the physiotherapists or by physical therapists. And if there is any importance for any surgical intervention, it should be also too easy to approach that and to be accessed if the doctor or the physician advise so, but surely after pure recovery. And this system approaches should be applied on the treatment, as I said, and the prevention during and after the infection. This system or this strategy, okay, it's very basic. And as Dr. Hadi said, we need a support. It's not only something that we can do it alone. It should be a work of a team. And we need to emphasize this on the government help as well. It should be financed. Some of these programs really require some kind of focus and more to rely more on the like support of many things from many parts. As an overall, it should be recognized as a disease. And everyone knows the risk factors and consequences on being obese. And how is that related to worsening the infection? During the infection, how in the body it will fight, the cells will be affected. Obesity as a number, it should be monitored, and surveillance must be enhanced to strengthen the effective strategies for preventing and treating it. And the obesity prevention strategies must be developed, tested, and implemented across the life course, as I said. And the treatment should be a combination, again, emphasizing on all different parts, and the system should be applied to be treating. What are the strategies to reduce the exposure during, for example, any kind of therapy, if it's group or individual? These are the things that actually we are focusing on and giving priority. We are, of course, limiting the number of participants, so that's why we are using some kind of social distance, or we can do it just online using the same approach. Maintaining some kind of follow-ups, and then patients, they should be trained on hygiene before prior coming to this kind of group sessions, where we give them hints and tips about how to handle their weight, what to eat exactly, what is the percentage of different bodies that they need to lose from each different different body frames. They require to lose different kind of percentages of the body weight, total body weight. It depends on the BMI. The higher the BMI, the higher the tendency for these people to progress better. And it depends also on the diseases that they have. If they have any other chronic disease that may influence their body weight or may worsening their case. So those who are diabetic, or those who are hypertensive or with cardiac problems, they tend to benefit most on the outcome after during the infection and after they recover. We see that these patients, they tend to have a better blood workouts, in general, better control on the blood sugar. And we need to keep in consideration that diabetic patient, during the illness, they tend to have a trend or a variation in the blood sugar. So keeping him on a healthy diet always as a diabetic patient will help in the outcome control if they get infected with SARS-CoV. Another well-based strategies to control the eating behavior in general, beside participation in virtual activities, we can give them calendars also, or diaries that we can monitor either when they visit us post hospitalization, if they were hospitalized, or on their follow-ups after they finish from, if once they get back to their normal routines, or over the phone or media or internet. It's some kind of a strategy that it might help them to remember, remind them the importance of keeping up with good, healthy tips or eating behaviors, or that someone is looking after them, so that this affected their behaviors really, and the outcomes of majority of the patients who recovered from COVID. And they actually help them to somehow for a better control on their eating behaviors, especially those who were non-stop continuously. They are thinking that they need more nutrition, so they tend to eat even more. And we need to understand the difference between different kinds of obesities, as some of these patients, they will be on steroids or any kind of medication that might lead to artificial weight gain, we call it. So certain diets or certain foods should be keep on mind to consider to help them in their cases. And the other strategies to maintain adequate food intake, calculating their needs on a daily basis is very important. So the role of dietitian during the effect or the infection effect of COVID on the bodies is very important, as it might give a big change for the patient, a better outcome with the advices, the proper calculations for, as I said, patient A and B and C were different, and each body frame has different kinds. So once we know how much exactly the body needs, And we try to accommodate that. For surely it's going to be leading to a better outcome. So we try to monitor their weight once every week or twice weekly, and we limit their intake of processed food, rich in sodium, rich in sugar, focusing on eating higher fiber content in the food, maybe including more variety of vegetables and fruits, pulses, having like low fat or low limited fat in dairy, or even avoiding animal-based dairy and including just plant-based dairy for certain amount of time actually help them. Limiting alcohol intake is very important, and always they should plan ahead. If they go just to shop and they don't know the base and what kind of food that will benefit them and what type of food they should be including, then it might put them on the wrong way, and they either buy so many things that is unnecessarily, or just and they forgot the important things that they should be having combination of food to have a balanced meal. That includes proteins, and it includes vitamins, minerals, starch, vegetables and fruits, and all of that. And how we encourage these patients to maintain physical activity. We give them a plan at home. As I said, during the infection, we try to give them something just to keep them moving, not exhausting them. But otherwise, if they are fit to exercise, we will go for the higher intensity or moderate intensity exercises and focus more on the breathing and focus more on the core strengthening, and then having regular follow-ups with the proper with the physician or the proper trainee, and show them the real technique, because otherwise if they don't follow the proper technique, they might injure themselves, especially people with higher BMI. They tend to they try to do certain exercises that might put a pressure on certain parts of the body. So exercising, it's very important, but it should be done in the right way. So in general, as I wanted to say, obesity, it's actually it's a disease in overall. And if we try to help our bodies to be healthy all the times, beating up not only COVID, any other inflammation or infection is gonna be really easier. As we put in our body, we strengthen our body and we put the base from the beginning. We know, we understand what is harming our bodies, how much calories we need to consume, what are the things that we should be avoiding, and creating this space in the home itself for our next generation. It is what makes us strong and what actually helps us fight such kind of diseases. I'll be happy to answer any questions if you have, and thank you so much for listening.
Thank you so much, Ruba. Thank you so much. 2 or 3 thoughts strike me. 2 or 3 thoughts strike me as I recount what Ruba has mentioned. Clearly, 60% of our population is obese, and clearly the majority of individuals who have COVID are also overweight or obese. Ruba has very clearly explained the role that weight management plays in the treatment of COVID. And that is a giant step forward in the treatment of COVID. And I'd like to thank Ruba for making mention of this. Secondly, I am delighted with her emphasis on the multidisciplinary aspect. Not only multidisciplinary in terms of diet, exercise, and other such components, but a multidisciplinary team. And this was also emphasized by Dr. El Hadi, that the management of obesity should move not only from the reduction of diet and the increase of exercise, but also to the medical management of obesity and the surgical management of obesity. Because 70% of individuals who embark upon a weight loss program invariably do not succeed. And therefore, we need to take the advice of our esteemed speakers, Dr. El Hadi and Ruba, to make weight management, obesity management, a multidisciplinary effort of health professionals, physicians, and surgeons. And with that, friends, I hand over to my very efficient and qualified colleague, Dr. Wilku, who would have compiled all the questions and will present these questions to our esteemed speakers. Dr. Wilku, to you, sir.
Thank you, Professor Kennedy. First of all, I would like to thank you, Dr. El Hadi and Ms. Ruba, for a wonderful presentation. Like Professor also mentioned, I have picked a few words from both the presentations. Dr. El Hadi has mentioned a very beautiful line. Obesity is not a character, it's a chemistry. It's a very wonderful line. You have to understand this. And because people, if the child is obese, if going to school, there is bullying. So you should not be worried about your character. You should be knowing about what exactly is going in my body and how I should take it to a better health. And second thing, like just now Professor also mentioned, nutrition should be a part of health system, which Dr. El Hadi has mentioned it and emphasized very strongly. Then I will come to Ruba's quotes. She has already mentioned best part for obesity management is behavioral change. That is in respect to motivation is very important. And Ruba has shown one slide, an obese person is carried in a stretcher by two healthcare professionals. It's a wonderful picture. And it's a cartoon which actually shows motivation is required. You might have noticed that the person who was sitting in the stretcher, he was still eating. He was too obese, but still eating. So motivation is very strong tool to change the behavior. Until unless you have a behavior change, it will be very difficult for this. And second thing, all of you have said, needs a professional team of professionals who will take care about the obesity management. I would add one more point. Family support should be very important, because if you have a strong family support in obesity management, it will work. Now, every time we are receiving a lot of questions when we announce the next upcoming webinar. And now we have received many questions, but I will just pick up a few questions in the chat box. Mr. Harsahaj has asked, my friend suffered from COVID last year. He had severe symptoms and was treated in hospital for lung infection. Since then, he noticed his weight was increasing. He had a weight gain. Do COVID cause weight gain, and how to manage it? Dr. El Hadi, I think you should better answer first, and then Ms. Ruba can answer her part.
I have a personal experience with this. Usually, okay, COVID leads to weight loss. It's a high metabolic, state. So weight loss is one of the features of COVID. If you've got especially severe COVID, okay, it leads to weight loss. And I can give you my own experience. Okay, I had COVID, okay, maybe in September last year. And fortunately, okay, initially my appetite was poor, but I was forcing myself to eat because I knew that, healthy eating is one of the factors, okay, which improve your outcomes. So I was eating. And then when I started to improve, my appetite even increased. However, I lost 14 kilograms in my weight. The only thing, okay, with COVID, which may lead to increase in weight, maybe because of isolation, sitting alone, doing no exercise, okay, being confined to home, you eat more, especially if you don't have severe COVID. That can cause weight gain, but COVID by itself does not cause weight gain. I hope that answers the question.
Yeah, it's very clear, sir. Then second question, Mr. Bharat has asked, I'm obese and I do office work. I don't have any other medical history, but I have a family history of diabetes. Am I at risk of getting diabetes? Ms. Ruba, I think you can answer, and Dr. Ilhadi, you can answer first, sir.
Okay. Well, I'm sure, okay, somebody with, if you had a first degree relative with diabetes, well, you are already by definition pre-diabetic. Obesity, okay, gets you more toward diabetes as well. So being obese and having a family history of diabetes, well, it makes you more prone to diabetes. And that's maybe a call for you to have some action, okay, on your obesity. Okay, because now you don't have diabetes, okay, maybe in the future you're going to have diabetes, so you should be acting on it. And if I were you, I'll be screened for what we call pre-diabetes and diabetes, okay, because you are one of the people who should be screened for diabetes. Maybe Ruba can add something as well.
Yeah. As you said, doctor, as being with obese, this is the first risk that puts him on, he might get diabetes. And then besides, I understood from the phrase, I do office work, so he's sedentary, so he needs to do some kind of physical activity as well in combination with a better eating plan. So if he's not taking care of the type of food, or and in general, his lifestyle, genes plays a big role as well.
Yeah, thank you, Ruba. Third question, which has been sent, my friend got COVID last 6 months ago and was asymptomatic, and she was in home quarantine, and now she feels breathlessness and she is overweight. What's the reason? I think these answers have already been given. If you want to add something, so you can add this. Ruba.
Well, again, this is not uncommon, okay?
Yeah.
Feeling breathless after COVID is very common, okay? You get that feeling. And we see a lot of patients who come to us, well, they are breathless, we are tired. And this is what we call post-COVID syndrome. Or even in other viral infection as well, you can get what we call, post-viral asthenia, okay? But with COVID, breathlessness is common. But he said, well, his friend is obese as well. Obesity by itself, by the way, is a cause of breathlessness. If you are obese, you could be breathless by, only by that. But after COVID, usually, okay, people feel tired and breathless, especially if they had, some lung involvement. What I would suggest for her or for him, okay, is to come and see a doctor as well, just to look if there is any other cause for breathlessness. But COVID by itself can cause those symptoms, even after getting cured.
Yeah. Thank you, Doc. Ruba, if you want to add something, you can just say.
I just wanted to say that this is what we were talking about, the importance of taking care of the body itself and the weight, and manage the weight, etc. in general. So in case of any infection, regardless it is COVID or any other infection, this is what happens. Even if the patient, see that this is of course an outcome of most of the COVID, post-COVID patients, but if we look at this without having any kind of infection, any patients who is obese or overweight, even when they start exercising, they will have this problem, because the extra weight itself, it's gonna put a burden on the body. So losing some weight or being with a normal body weight and frame, it's much helpful for these cases.
Yeah, thank you, Ruba. One wonderful question. The person is feeling hot flushes. He is overweight. So is it due to the obesity or something else? So Dr. Ilhadi, I think you can answer this better.
Well,
Hot flushes.
I'm not aware of hot flushes as a symptom of obesity or overweight, but I can just contemplate. Okay, it depends if she's a female, or if the one who's answering is a female, maybe with obesity, or we spoke about polycystic kidney disease, polycystic ovary disease. Okay, you may get some hormonal changes. Okay, that could explain hot flushes, but I'm not. And again, you know, obese people are more prone to endocrine disease as well in general. But I'm not aware of hot flushes as a symptom of obesity.
So he's a boy and he's 19 years old. He has previously sent the query also. I am 19 years old and my both parents are obese. He is a little bit overweight and now he's feeling hot flushes. So he's worried about whether it is due to overweight.
Well, I don't think it is that's a cause for it. But if I were him again, I will seek medical advice, because there are other reasons for hot flushes. Yeah. Some of them are, you know, serious. Some of them are, you know. So he has to be investigated for that.
Yeah. Thank you, Doc. I think most of the questions have been answered, and whatever queries we have received, it's more or less almost answered all them. But we will just reply to them in the mail. One direct question has been asked by one gentleman. He is asking, I would take liberty to answer that. He is asking, after taking both the jabs of Covishield, one of the vaccine in, I think, in India, and what are the steps to take a precaution? So, gentlemen, I would like to answer this. See, whether you have taken a jab or you have not taken jab, all the parameters, all the precautionary measures which you were following before taking the jab has to be followed. It doesn't say you have taken a jab, that doesn't mean you are 100% safe. You still be a carrier, you can spread. And suppose if you have taken a jab and you were already infected and you were in the window period, it will come, but definitely the complications will be reduced. So my advice, just follow 3 simple rules which WHO and every organization is saying: social distancing, using a mask, hand hygiene. These things you should be continuing even after taking a jab. I think, Professor, there is no further questions. So over to you, sir.
Thank you, Dr. Wilku. And thank you, Dr. Ilhadi and Ruba, for your wisdom. And I do not use that word lightly. I mean it very seriously. Thank you for your wisdom. I have been listening to the answers, the questions that were asked, and I was delighted with the wisdom of the answers. Absolutely mind-boggling. That is years and years of experience and great confidence and learning. Thank you so much. That was so contributory to our listeners. Thank you so much. Now, friends, I am ever so grateful to Dr. Ilhadi and Ruba for their presentations and their wisdom. And I would like you to know that every word mentioned by our esteemed speakers has been recorded. It will be put up on our site almost immediately. We will then edit it about a week later so that we wipe out all the unnecessary noise in the system, and it will remain permanently. This is our 12th webinar, and we have all these webinars, 1 hour or 1.5 hours of knowledge on our website. Please log into our website and go over this. It is very informative, not only to our patients, not only to medical students, but also to our colleagues in the health and medical profession. Our next topic in our webinar 2 weeks from now, our next topic is post-COVID, as always, cardiac disorders and its management. Post-COVID cardiac disorders and its management, I am sure we will have an outstanding cardiologist and other health professionals who will help us to steer this program through. With that, my dear audience, thank you so much. My speakers, Dr. Ilhadi and Ruba, thank you so much. My colleagues who work behind the scenes to bring about this program, thank you so much. And with that, good day and all the best.